Welcome back to your favorite low production YouTube channel, but still high quality. And today we've got a very niche topic, little interesting of a topic, but it's going to be chronic urticaria, also known as chronic hives, and some two different ways that you can go about helping treat that possibly. And again, it is important to know that I am not a doctor, and so you should definitely not listen to me in any regard. You should definitely take the advice of your physician. I am merely here just to present the information to you that is readily available on the internet through scientific literature for you to present to your doctor as well, to talk to your licensed physician all about what you should do. I'm not here to give any medical advice, but just some things that I'm the middleman in sharing some information so that maybe it could possibly help you out. So with that being said, let's get into everything chronic hives. So for starters, let's click that out of this. Let's take a look at everything that chronic hives really have to offer. What's their mechanism of action? And so really what it looks like is you have this signaling cascade of events that end in your itch or the rash that you're experiencing. And so what that looks like is you have an antigen or an allergen that stimulates this antigen to bind to this compound called IgE. It stimulates these mast cells to release histamine, and then that histamine molecule binds to its receptors, specifically on different cells, also like your nerve cells. Basically, that'll be like the itching part of it, your sensation, as well as your blood cells as well too, to stimulate other vasodilation and the redness of the skin that you're experiencing. So that's really what that whole process looks like. That process essentially just always turned on, and that's how you get your chronic hives. Now, it's important to note, there are certain things out there that you've probably, if you have chronic urticaria, chronic hives, there's things out there that you've probably been prescribed by your doctor, such as like Zyrtec, Xyzal, Allegra, Claritin. Basically, it's a class of drugs called your antihistamines. And what that does is it works in the action of blocking these histamine molecules from binding to its receptor on those specific nerves or the other cells that'll produce vasodilation, the redness of the skin, okay? And so really what that looks like is all this histamine is still being released. You still have your antigen binding the IgE, binding these mast cells to release all this histamine. So histamine's still readily flowing around, but it has nothing to bind to, so it can't exert its effects to actually make you feel it. However, do I think that this is the best option overall for, let me enlarge myself a little here. Do I think that this is the best option overall in terms of treating your chronic urticaria? Probably not. Why do I say that? Probably anecdotally, if you're still experiencing some problems. And so the reason for that is really because there is some sort of tolerance that is developed when it comes to antihistamines. And so really what you're looking at is anywhere really between like 7 and 20 days, it's even found, to develop a tolerance. And really what you have to do there is to either hop off of those antihistamines, which would then you really have a lot of those chronic hives for about 3 to 14 days, which would be a period of not so great happy feelings, or you just have to continuously up the dose of those antihistamines. So in the short term, to treat things like just regular hives or regular allergens, those things can definitely help. However, is it the long-term solution? Probably not. And it's the reason why there really isn't technically a cure for chronic urticaria or chronic hives. It's just something that can slightly be managed for the most part. And typically it's usually done as the first step through antihistamines. So what about some other things that can be prescribed or other things that can help you throughout this process? Well, let's take a look back at what we can do through this process. So if we go another level above this, right? So the antihistamine is the thing that's blocking the histamine from entering or binding to its receptor to stimulate your sensations. And so that's how that works. What if we go a level above that, which would be to block the thing that's actually releasing the histamine itself, right? So let's say if we can block IgE. There are definitely things out there that can do that. So let's kind of evaluate, is IgE, is that even a good methodology of thinking if we're looking at blocking general inflammation or blocking some sort of hive type response? And so this is a paper done in 2021 by Aldrich et al. Looking at the total IgE as a marker for spontaneous urticaria. And long story short, they found that the results of the review found that total IgE is a valuable marker for CSU or chronic urticaria, and recommend its assessment for routine diagnostic workup of CSU patients. And so it is a good way of thinking if we're looking at trying to treat or as a diagnostic to see what's going on with the chronic urticaria. We also know this because there are already drugs out there, such as Xolair or omalizumab, which are prescribed in certain cases to treat chronic spontaneous urticaria, not controlled by your antihistamines. So for the same exact reasons like we were talking about, just going a level above when this kind of gets tolerated at that histamine level, they just go a level above and try to block the IgE from binding it in the first place, okay? So you're probably thinking to yourself at this point now, well, that's all nice and dandy, but I kind of wanted this just go away without the use of pharmaceuticals. Is there any way that we can do that naturally? I'm so glad you asked that. Let's take a look to see if we, there's another mechanism of action that we wouldn't have to result all the way to pharmaceuticals to do that blocking of the IgE. So in general, what we're really looking for here, like I said, is to block that IgE. Now, is there really a problem in terms of IgE always being chronically elevated that we can kind of pinpoint to see if we can keep that at bay? Now, in the case of a lot of chronic diseases, we're really looking at genetics. That's kind of a large part. Like, why do you have chronic urticaria, right? Why you and not somebody else, right? It's because you're you and you're made up of your genetics. And so these are 3 genes that are specifically implicated, at least here from this paper by Freeman, 2010. Clinical manifestations of hyper IgE syndromes. Now, of course, these are specific diseases and syndromes that are located. 3 of those genes are the STAT3 gene, DOC8, and type 2. Now, in general, type 2 and DOC8 are more related to other skin conditions, things like eczema. You even see here DOC8 characterized by severe like warts and other malignancies at young ages. So really, we're looking at the STAT3, and that's what we're going to focus on, the STAT3 gene or the STAT6, really a whole family of STAT genes. And so what STAT genes really do is they are a protein, or it's the gene creates the protein, the STAT6 protein, which would modulate gene expression. And so I know this is kind of getting a little bit out of hand, a little bit technical, so I'll try to make this as simple as possible. But you have this STAT gene, so your gene, let's say it's like red on like this really long script, and you have this STAT6 gene over here, and then once that's read, it produces the STAT6 protein, and then that goes and floats over, and it stimulates this other gene to be overexpressed, IgE. And so we'll talk about that in a second. So going to more so like IgE, we see here that STAT6 is implicated in overproducing or just producing in general. Let's say everything's normal. STAT6 produces some IgE, or at least allows for the expression of IgE to be created, as well as a bunch of other things, interleukins, which we're also going to get into in just a second. But really, essentially, we're looking at like what's creating all this IgE to always be readily available, that is always increasing this histamine. So like, why is this IgE always so present, and then it's always binding these mast cells, and that's always creating this histamine, and then that's why you really have a bunch of sensitivity where you're having chronic hives 20 times throughout the day randomly. It's because IgE is always present for some reason. And so that could either be due to a very severe like sensitivity to specific allergens. That's why you have like peanut allergies, and that's just a regular marker of just allergen IgE is. Or it could be something genetic that's always predispositioning IgE to always be present, and then leading to this down signaling cascade. So STAT6, the STAT genes, the STAT family, STAT6 implicated in that production of IgE. And so what are some things that we can do naturally then to keep STAT6 at bay? Obviously, without gene modification, we can, but that wouldn't be as natural then. Going in and editing this STAT6 gene, let's say you have that predisposition or the polymorphisms that are allowing STAT6 to always run rampant, to then always allow IgE to run rampant. Without gene modification, what are some things that we can do to keep STAT6 at bay? And so some things that we can do here, let me move my face to this side. It's going to be acupuncture, vitamin E, picogenol. Those are kind of like 3 pretty top things that you can do. Now, in terms of systemic chronic urticaria, what's probably going to be the best option? Probably vitamin E, as well as the fact that it's always kind of readily available. It's something that's pretty easy that we can get through our diet and or easy supplementation with a low side effect profile. Acupuncture really kind of localized in a very specific area, so that's like more for like migraine stuff, inflammation of specific areas of the skin. But if you have chronic urticaria, you probably know that it's kind of all over the body, so we need to work from the inside to keep those STAT6 levels at bay throughout the whole body. We need it working from the inside, not just at like specific areas of the body. Okay, so we're going to really look toward vitamin E as being a possible therapeutic or remedy, natural remedy for blocking STAT6, which would then block IgE from always being so present, which would then block histamine from always being present, which would then block that sensation that you get from chronic urticaria, the itching and the swelling, right? And so is that a possible marker? Well, these studies show yes. Also, this study, which is an updated review of the anti-allergic effects of vitamin E in allergic diseases, specifically like CSU, I'll just kind of go to the highlights here so you don't have to, you guys can all, by the way, look up all these studies. That's why I show the title and all that stuff. Go dig into it. Don't take my word for it. It's all out there, right? But let's just kind of like look at the highlights here so you don't have to dig through it right now. Vitamin E inhibits the eosinophilic and the neutrophilic inflammation of STAT6 inhibition. And so vitamin E is a strong marker for the inhibition of STAT6. So if you have STAT6 that's always running really, really rampant based to a genetic mutation or polymorphism, whatever you want to call it, vitamin E could be a thing that slows that down, brings it back to where it's supposed to be, so that IgE is brought back down to where it's supposed to be, so that the mast cells are not always releasing histamine, and brings that back to normal function, to where your nerves and all the other manifestations and the symptoms that you feel from your chronic hives aren't always turned on. And so essentially what we're really looking at here is vitamin E being a possible natural remedy to reduce or even possibly rid, which I got to be very careful when I say those things, again, not a doctor, but it could be a possible remedy in managing your chronic urticaria from the inside. So that is essentially all of like the scientific evidence that's out there. Again, I'm not a doctor. Please go check with your doctor, but it is something that is readily available for you. Vitamin E can get through your diet or through supplementation. The normal dose of vitamin E would be between about 500 IUs to 1,000 IUs. If you're having chronic urticaria, I would stem to go toward the higher end. Obviously, you really want it to work. And yeah, really kind of keep everything at bay. So 1,000 IUs there would probably be the best option. Yeah, vitamin E. That's kind of it for this video. Hopefully that helped. If you're wondering about what are some other possibilities of chronic urticaria that's not related to IgE, there is another possibility, and we will get into that in the next video about this. So if, like, let's say you try this out, vitamin E doesn't really work, you probably didn't have this STAT6 mutation or the polymorphism in your gene, so you got to look to do some other things. So what are some other things that you can do? We'll cover that in the next video, but for now, that is the effects of vitamin E as a possible remedy or therapeutic for your chronic urticaria management. Hopefully that helps. You guys can try it out, consult with your physician. Yeah, that's it. Free sauce. Anyways, I'll catch you in the next one.